Hello, it's the Fly Foot Doctor. Welcome. If you don't know who I am, I'm Dr. Show. I'm a foot and ankle surgeon and specialist out here in Houston, Texas, and I talk about all things foot and ankle as well as snippets of little fashion and personal stuff on this channel. If this is your first time here, welcome. Today we're going to be talking about blood circulation or the lack of it, and we're going to talk about the symptoms, what causes this, what is it, things that you can do at home, and how we can prevent it from happening to you. If that's something that you're interested in, stick with me and let's get into it. All right, I had to come in here and talk about this because unfortunately I lost some of my footage, but I do want you guys to get the information, so here it is. Now, what is peripheral arterial disease? It's essentially poor circulation, when you just don't have enough circulation to get you where you need to go or get the blood flow where it needs to go. It is primarily caused by atherosclerosis, which is a buildup of fatty tissue and gunk and things like that in the blood vessels that usually could be indicated that there's something else that could be going on. So imagine that you're a plumber or that you own a house. I like to think of the blood vessels as plumbing. With plumbing, you have pipes that go all around the house. If there is a clogged pipe somewhere, there could be backup. And that's where sometimes you see the sink starts to back up, the bathtub starts to back up, because there is stuff that is clogging up the pipes. So essentially that's what happens. If there's a backup, there's not enough blood flow, then that causes things like non-healing and other things that I will talk about, as well as far as the symptoms of poor circulation or peripheral arterial disease. Now, we know what peripheral arterial disease is. Well, what are the risk factors? Well, one of the risk factors is obesity. Of course, if you're obese or you have a sedentary lifestyle, it doesn't allow for a lot of blood flow through the body. So that's one of the things that we want to make sure that we're eradicating from our lifestyle. Things like diabetes, high blood pressure, high cholesterol, all of those compound and result in a situation that does not favor adequate blood flow. With diabetes cause hardening of the vessels and doesn't allow blood flow to go through it. With cholesterol, of course, it's a buildup of bad fats that are now being deposited in our blood vessels and things like that. High blood pressure also causes injury to the vessels, and that's a video for another day. But again, those are risk factors for lack of adequate blood flow. Age. Patients that are older than 50 have a higher chance of getting blood flow issues. So you want to make sure that you're keeping with your doctor's appointment, you're paying attention to that and getting regular follow-ups. And one of the most important one is smoking. And we'll talk about that in the next clip because I do think we did have that clip. Now, what are the signs and symptoms of peripheral arterial disease? Well, I'll say something. If you have a wound that has not healed for a long time, you've taken care of it at home, you've been to a doctor, and it's just not healing the way it's supposed to heal, that is a sign that you may want to check to see if there are blood flow issues that could be preventing this wound from getting better. If you usually could walk 1, 2, maybe even 3 blocks, and then all of a sudden you walk a block, you walk 2 blocks, and your legs start to hurt, they starting to cramp, and it's starting to cause problems, you may want to make sure you check that your circulation is adequate. Because what I like to term it as is, if your circulation is not great, what could be happening is your tissues are screaming for blood. They want blood. They want oxygen. Not really the blood, but the blood brings the oxygen. So they are screaming for oxygen. And their way of screaming, since they can't talk, is by causing you pain and discomfort. We usually will call that intermittent claudication. You walk for a little bit and you just start to have pain. Usually 10 steps and you're having pain in your calf and cramping and things like that. You definitely want to check it out. If you're having weakness in your legs and you're walking, that could also be a sign that you're having blood flow problems. If your beautifully colored skin, your beautiful texture of your skin starts to change, you're starting to lose your beautiful color, you're starting to lose your normal color, you're starting to have hair loss, your skin is not looking as supple, as fresh, as nutritious, or as nourishing as it used to be, then you want to check, because when there's adequate blood flow, you have nice hair growth, your skin is soft, it's not dry, it's not flaky, it's not hard, it's not discolored. So if you're starting to see these things that I mentioned, you want to make sure that you check it out, because that could be a sign that you're not getting adequate blood flow to your legs, your toes, your fingers, or anywhere in your body. If you're noticing that you used to have nice nails as well, and your toenails or your fingernails used to grow beautifully, but now they're slower, they're more brittle, they're hard, they're cracking, and they're flaking, that may be a sign that you don't also have blood flow. So we want to check that as well and see and kind of keep a mental note of how often you used to cut your nails, and maybe you're not cutting it as often anymore because it's not growing as much. You want to check and find out why. Also, if you're able to measure the pulse on your foot, you want to check it out and see, can you still feel the pulse? Because once we start to lose the pulse in our feet, that's when we start to know that we're lacking blood flow and we're losing blood flow in our feet. Now, what are the causes of peripheral arterial disease? Essentially, it's when there's blockage in the artery. Remember the plumbing analogy I used earlier? Your arteries also are like plumbing in our body. They transport blood from the lungs and to the rest of the body. And so if there's any blockage either in your heart, and that could cause a heart attack, or in your brain, and that could cause a stroke, or in your lungs, that could cause a pulmonary embolism, or in your toes and your fingers, that is something that we want to make sure that we take care of. And then what could cause these blockages? Well, like we talked about, high cholesterol, maybe diabetes, high blood pressure, if the arteries aren't moving the way they're supposed to be moving, if they're old and rusty, which the arteries don't get rusty, but a similar idea of a rusty artery or a rusty pipe could be applied to the artery as well. Or if there's fatty deposits from high cholesterol. So when your doctor keeps saying you need to lower your cholesterol, this is what they're talking about, because that excess cholesterol could go sit in your arteries and block it and not let adequate blood flow get to where it needs to go. So we need to be cognizant of this and keep a close attention to this. If you are a smoker, one of my top tips for you to try to quit smoking is this. Come closer, let's talk about it. So if you smoked, say 10 cigarettes a day, which is, I think it's a pack a day, under 10 cigarettes in a pack. What I want you to do, if you take a cigarette, smoke it halfway and put it out. Don't smoke the entire thing, only smoke halfway. Now what this does is it quenches that craving, and it also helps you to absorb and consume less nicotine. Now don't throw that half away. Keep it aside, because guess what? You're going to have that craving again. When you have that craving again, smoke the other half. Now, before you know it, you're not smoking 10 cigarettes a day, you're only smoking 8. And before you know it, you're smoking 6 and 4. And you're going to space out the time in between you indulge in your cravings. So you're not smoking the entire 10 packs of 10 cigarettes a day. You're now hopefully getting to 5. And that's how you're going to cut down. I know it's hard to cut cold turkey. I mean, if you've been smoking for however many years and you've just been told to quit, it's hard. Give yourself grace, but stick to the plan. I promise you, I have gotten quite a number of people off smoking using this method. Give yourself grace, smoke only half, use the correct gums and all of those other things to kind of help support you throughout this journey. Remember, smoking is the #1 risk factor that is preventable. 80% of people who have poor circulation or peripheral arterial disease have said that they have smoked in the past or are currently smoking. You can prevent this. Use this trick. Let me know what you think. Leave a comment down below if you're going to do it and say, I will do it, or I have done it, or I am doing it. Leave a comment down below. I'd really love to hear it, because I think this would be the single most thing that will really help you improve your blood flow and circulation if you are a smoker. So now we've identified what peripheral arterial disease is, or poor circulation, the risk factors, some of the signs and symptoms, as well as the causes. Well, now that we know all of that, what can be done? Of course, there are medications and surgeries and things like that that can be done to help prevent it. But for you at home, how can you help yourself, your family members, your brothers, your sisters, your parents, anybody? Well, one of the most important things that you do is to stop smoking. We've talked about that. I've given you a quick trick. Comment down below that you're going to do and help with this. The next thing is eating a well-balanced diet meal. A meal that is low in fats, so you don't increase your, fatty deposits in your arteries and things like that. That'll help you clean the vessels. It'll help clean it out. It's just like, Drano in the drain. Cleans all that gunk out and let adequate blood flow get to the area. Now, Sometimes with peripheral arterial disease, the vessels are already compromised, and think of it like the pipe is already rusted and busted, and we can't quite fix it, and that's when surgery comes into place. But I'm talking to those people that are still early on in the disease, and we can still help to correct it. So eating a well-balanced meal, stopping smoking, exercising regularly. Now with exercise, I don't mean you need to go sweat like a Christmas goat. No, all we need you to do is just take a brisk walk 30 minutes a day, 3 times a week. Now, don't walk too much that you bust your knee now. That's not what we're saying. But walk enough that you kind of have to, breathe a little faster than normal. You want your heart rate to go a little faster. If you're walking leisurely and not doing much, it's better than being sedentary, I promise you, but you want to challenge yourself. Every day, do a little more. Every day, go a little faster. Every day, go a little further. And little by little, you will find yourself looking like a lean, mean, no blood flow problem having machine. Consequently, if you have things like diabetes, blood flow issues, and all of that, you want to make sure that you are controlling it, taking your medicines at the appropriate time, at the appropriate frequency, at the instruction of your healthcare provider. You don't want to skimp on this, because that is important to controlling blood flow issues as well. We've talked about how if we don't control it, there are things that can happen, with the worst being amputation or loss of toe, foot, or limb. We're trying to prevent that while we can. So I've talked about the things that you can do at home. The rest of the stuff like medication, surgery, and all of that, they will be taken care of by your doctor. But if you at least stick to this, a diet, stopping smoking, controlling the other diseases, being active and stuff like that, you'll see you will start to get better and start to feel better. Well, how about my foot people? My foot people, this is what you're going to do. Every day, make sure that you are inspecting your foot. Look between your toes, look at the bottom of your toes, and if you can't quite bend right there to see it, get a mirror. Put your foot over the mirror and inspect the bottom of your toes to make sure that there's nothing going on. After you shower or wash your feet, make sure that you moisturize. If you have a crack in your feet, that is just a nidus for where blood flow is going to have problem getting to. So we don't want any cracks. So make sure you moisturize as much as possible. I personally like moisturizers like CeraVe, Cetaphil, Lubriderm, Eucerin, and I like creams over lotions. I'm not sponsored by any of these brands, although, hey, come on through, but I'm not sponsored, but I really honestly believe in them, and I also even use a few of them at my home myself. So after you shower, make sure you apply these creams over your foot and then lock in the moisture with an oil, or even one of these moisturizers like petroleum jelly, good old Vaseline, Aquaphor. Those are great. You moisturize, you put the lotion over there, and it'll work amazingly well. Make sure that you're wearing the appropriate socks and shoes, nothing that'll cause friction or a wound, because we talked about wounds. If there's a delay in wound healing due to blood flow issues, that's a little bit concerning, and we don't want that. So make sure that you are wearing the appropriate shoes and socks that are not causing any friction or anything like that. All right, we've come to the end of this video. We've talked about blood flow issues. We've talked about what it is, what causes it, the risk factor, what you can do at home to try to prevent it, and things that you can do with your foot. So which one of you are going to take one of the tips that I gave and put it and apply it to your daily lifestyle today? Let me know down below. Comment down below, and I will do this and I will reverse this. That'd be so awesome. That'd be so great. And also, if you're gonna check your foot and as well as inspect your foot, let me know down below. I would love to hear from you, and also encourage you and cheer you on as we go about trying to eliminate, prevent, and control blood flow issues. Now, if you've watched till the end of this video, thank you so much. If you've gained any insight or knowledge, I really appreciate you. Now, would you consider subscribing in our channel? It'll really help the algorithm and help this video get shared to other people who would truly benefit from this. Also, if you like the video, would you consider hitting the like button down there and share it with your friends, your family, your neighbors, your parents? You just never know who is going to benefit from this. If you'd like a consultation with me personally, visit our website or give us a call, 832-415-1790. I look forward to hearing from you. Thank you so much for sticking till the end. I really appreciate you. I'll see you next week. Till next time, it's the Fly for Doctor. Bye.